This morning, our first speaker is Ms. Ware. Ms. Ware has a Master's of Library and Information Science from Louisiana State University. She is a member of the Academy of Health Information Professionals and has a specialization in consumer health information through the Medical Library Association, or MLA. She is editor of MLA Connect's newsletter education section. She is also president of the Health Sciences Library Association of Louisiana, chair of the Louisiana Library Association Subject Specialist Group, and president-elect of the South Central Chapter MLA's Hospital Library Interest Group. A link to a copy of her presentation is being put in the chat. When we send the follow-up email with links to the videos, links to the PowerPoints will also be available. Ms. Ware?
Thank you. I am pulling up my presentation. I'm going to talk to you today about some of the health resources available for consumers. There's an increased need for health information during pregnancy, but that is confounded by the fact that information literacy, especially health information literacy, is low in the United States, and more than half of Americans read below a 6th grade level. After this presentation, you'll be able to answer the following. Where do pregnant people go when they are seeking information? And is the information that they're finding safe and trustworthy? Also, where can pregnant patients find reliable and free information? And what can we do to help get safe and reliable answers to health questions into the hands of the pregnant people and new parents that need them? When pregnant people are seeking information, the most common sources are friends and family, social media, the internet, and smartphone apps. We're going to talk in depth about the social media, or more in depth about social media, internet, and apps. But first, I wanted to talk about getting health information from friends and family. When I was expecting my son, I was a school librarian, and I had a class of 9th graders in the library, and I reached up to get a book off the top shelf. And all the girls in the class started screaming because they had all heard from their grandmothers and their mothers and their aunts that if you reached above your head, the umbilical cord could wrap around the baby's neck, which, that seems like a harmless enough misconception to have, but then that can lead to exercise avoidance during pregnancy, which can lead to increased weight gain, excessive weight gain, and, trouble with delivery. So 95% of pregnant patients reported using the internet to answer their pregnancy-related questions. In a 2011 study, 75% of participants reported using smartphone apps as an information resource during pregnancy. And I think that, in the last 12 years, that will have only increased. A more recent study found that 100% of pregnant people use social media for pregnancy-related purposes. Some popular commercial internet resources are Baby Center and What to Expect. These are actually more high quality consumer health resources for pregnant patients, because with Baby Center, all the articles are written by medical writers or healthcare professionals, and every article is reviewed by a physician, and you can look at the names of the physicians and where they work and their specialization. What to Expect is much the same. The articles are reviewed by a medical professional, and the articles have in-text citation links to show the original source of the information. And they have a check mark to show that it's a trusted source like NLM or Mayo Clinic or wherever they got the information from. When I was reviewing articles on Baby Center and What to Expect in preparing for this presentation, I didn't find any that were harmful or contained risky advice in the actual articles, but they have forums on the sites that are a free-for-all, and they both have a lot of ads. Another problem with websites like Baby Center and What to Expect is they are written at above a high school and above level. I took just a selection of 4 and ran them through some readability analyzers. The one on the end is the ATOS level. You may be familiar with that if you've ever had a child or yourself that had to do accelerated reader in school, because that's the AR book level. And it's the one on here that directly goes with grade levels. So the two Baby Center articles, one was a 10th grade level, one was almost a 12th grade level. The What to Expect articles, one was almost an 11th grade level, and the other one was an 11th grade level, which means that at least half of Americans won't be able to read and understand the information in those articles. Some popular smartphone apps are another common source of information during pregnancy, but very few apps have high quality information. Most are average quality as far as like app design goes, but the information is below average quality. Some promote information that is actually harmful. One that I saw, and it's a popular app, said that dairy products wash away mommy's calcium and this can damage the baby, and that you shouldn't drink milk when you're pregnant, or any dairy. A study looked at all the available pregnancy-related apps on the Apple App Store and the Google Play Store. This is the first page of the apps. It was a 16-point scale. None of them scored 16 points. The highest one was the Baby Center app, and it was a 15-point score. Another thing that I noticed is a lot of the pregnancy apps are pretty expensive, and they automatically renew after a year. Well, the pregnancy will be over by then, and then the new mom or dad is going to have to remember to cancel the app. It doesn't charge them another $50 while they have no sleep with a new baby, and brain fog, and that just seems predatory to me. So it would probably be best to advise your patients to avoid getting information from smartphone apps. Also, this is just the first page of the app. So these are the best, these are the highest scoring ones. And that app that had that wisdom about washing away calcium is on this page. Patients should not rely on social media for information, but most likely they do. There are, however, many qualified physicians and nurses and dietitians making high quality content for social media, but somebody would have to specifically seek out those sources. The ones that rise to the top are the more popular influencers, and it doesn't matter if their information is harmful or reliable. It's not going to affect where they rank. Another thing, groups for specific ideologies can serve as echo chambers to promote unreliable health information, just like we saw with COVID. It's the same with pregnancy. Patients need to be able to recognize reliable information on social media, but they may not. They may not do that. So I did some research on some social media apps to see what I could find. I did a search on TikTok, which is, a new popular social media app. And I searched what to eat while pregnant. And the first video, it was tagged pregnancy foods and what I eat pregnant, showed the poster eating 2 lunch meat sandwiches with, cold deli meat and a lot of coffee. The second video was about how to follow a keto diet while pregnant. And what she did at the end of the day after following the keto diet is eat a tub of sugar-free ice cream and a tub of sugar-free Cool Whip. Some Facebook groups that I looked in, one person said they were craving sushi because they were pregnant, and people were giving her recommendations for sushi restaurants to eat at. One person said, "Hey, I know you probably know this, but you can't eat raw fish when you're pregnant. But this place has good California rolls." And people argued with that poster and told her that eating raw fish is a personal choice and that they ate raw fish and they were fine and to leave her alone. And another that I saw in a Facebook group, somebody said they were pregnant and they wanted to know if vaping was okay because they had tried to look it up, but they'd found conflicting information. So apparently they had found some information somewhere that said to vape. And there were, again, a lot of people telling this pregnant person that they vaped when they were pregnant and their baby was fine. So the information that people are getting from social media is, there's no telling what they're getting. So you might be thinking, we really need some high quality information resources that patients can understand and read, that they don't have to pay for, and that they can easily access from anywhere. And the good thing is we do. So we're going to look at some of those now, and I'll talk about what we can do to get these resources into the hands of the patients who need them to help have a healthy pregnancy. My personal suggestion would be to tell all your newly pregnant patients that they need to bookmark Medline Plus. They can make it their homepage in their phone and use the search function in Medline Plus. Medline Plus is a product of the National Library of Medicine. And the great thing about Medline Plus is not only does it have high quality, easy to read information on its page, it also links to other high quality resources as well. So if somebody has questions about gestational diabetes or pregnancy with Hashimoto's, they may want more information than is available on Medline Plus, but if they search that topic in Medline Plus, it will link to other NIH pages, it'll link to HHS pages, and other high quality sites like Mayo Clinic and the American College of Obstetricians and Gynecologists and the American Diabetes Association. Everything that it links to will be safe and trustworthy. Medline Plus has a plethora of health topic pages on pregnancy and reproduction. You can see all these here. They're pretty in-depth, and there are a lot of them. You can also, there's a pregnancy topic page that's a wonderful resource for newly pregnant patients. It has everything. It's got tips for a healthy pregnancy, what to eat, links to other wonderful resources. It has info about early pregnancy symptoms, has a pregnancy calendar that shows how big the baby is at various stages and what to expect at various stages. It even has a section on what tests to expect during the pregnancy and links about exercise during pregnancy. They even have links to things like how to tell kids that they're going to have a younger sibling. So there's so much on Medline Plus for pregnant. If you search pregnancy complications on Medline Plus, it brings you to specialized information from a number of different sites, again, both from the NIH and external sources of information. You can filter the results to show only NIH resources, or if you only want videos or images, if that's the user's preference, they can filter it for that. This general search on pregnancy complications brought up over 1,000 high quality resources that patients don't have to guess about the veracity of. There are many resources about pregnancy and nutrition, and they won't tell your patients to go eat some raw tuna. Another great thing about NIH and HHS consumer health resources is all the articles are written at a 5th to 8th grade reading level. Some are easier to read, and they're tagged with like this first result, they're tagged easy to read. So if somebody sees that, they'll know that that's going to be even easier to read. This Have a Healthy Pregnancy page from My Health Finder from the OASH, the Office of the Assistant Secretary for Health. That falls under the umbrella of Health and Human Services. If you look at the highlighted portions, you can see that they define words that might be unfamiliar to people, such as prenatal care and midwife. This information is also available in Spanish too, and it's written in Spanish, not just translated by a computer. So it's easier to read that way. And then if you click the Take Action heading, pregnant patients can find information about finding prenatal care and eating healthy, planning for a newborn, what to expect with a newborn, and so much more. There are many groups that fall under the umbrella of Health and Human Services, like the Eunice Kennedy Shriver National Institute of Child Health and Human Development. And of course, they have many pregnancy-related resources. It's an excellent resource for not just patients, but healthcare providers also. This is one of their current initiatives, the National Child and Maternal Health Education Program. They have a pregnancy for everybody about plus size pregnancy care. They have a lot of great printables like this, and they have printables for patients, what to ask your provider. There's so much information that is just wonderful information and free, and most people don't know about it. So if we can get patients to start their searches at Medline Plus, that opens up a whole world of information. A notable subsidiary of the OASH is the Office of Women's Health. The Office of Women's Health has a wealth of information about reproductive health. There's information about everything from ovulation to breastfeeding. There's also information devoted to maternal mental health like this. This includes a fact sheet for patients with information about how to recognize symptoms of postpartum depression, how to find treatment, and how to locate a provider. They also have a toll-free helpline to connect with people who are struggling. This is a patient information page on cardiomyopathy during pregnancy from the National Heart, Lung, and Blood Institute. It includes a link to questions patients should ask their doctors if they've been diagnosed with this condition. I came to this page through a search in Medline Plus for Hashimoto's in pregnancy, and it linked to the National Institute of Diabetes and Digestive and Kidney Diseases. And it's got so much great information. The Centers for Disease Control and Prevention also has a lot of pregnancy information, like this page on gestational diabetes that teaches people about risk factors and the symptoms, and what they can do to avoid gestational diabetes, and what to do if they do have gestational diabetes. The Dietary Guidelines for Americans is updated every 5 years. It's done through a partnership between HHS and the USDA, and they appoint a committee of nutrition and public health experts to review evidence. So it's all evidence-based. They update the guidelines every 5 years. It has an entire chapter on the nutritional needs of pregnant and lactating women, and it has several guides that can be useful, like this. This first one shows what percentage of your calories should come from each food group while you're pregnant. The second one shows how many extra calories you should eat while you're pregnant. And then the final one is how much weight you should gain based on your body size at the beginning of pregnancy. The Food and Drug Administration has a portal on food safety for pregnant women and their unborn babies that covers everything from nutrition to safe handling and what to eat and what not to eat. The Substance Abuse and Mental Health Services Administration has so much information for pregnant patients. They have, like, this article is about the risk of using marijuana while pregnant. There's even YouTube videos to go along with this information. And, I know this is a lot. I've talked about a lot of different resources and a lot of acronyms. The great thing is you don't have to remember these. You just have to remember, just start at Medline Plus. It links to all of these and many, many more. So please just encourage your patients to start their searches for information about pregnancy from Medline Plus. There are also many high quality printables and pamphlets that you can print out to put in your office or to give patients. This one is about depression and anxiety during pregnancy and postpartum. It's from the NICHD's website. There's not a great way to find printables on Medline Plus because it's patient oriented rather than provider oriented. But you can find linked printables by searching a topic and then selecting PDFs, and most of those will be printables. You can also find them by going to any of the other pages, like the National Maternal Health Education Program, and then looking at initiatives or materials or patient handouts. This works for like the CDC and all of them. Health.gov has a lot of great pregnancy printables and posters for their Move Your Way campaign. These are just a few of them that are available. These are from the CDC, and they're all free. That's the great thing. You can get a lot of great printables from ACOG too, but you have to pay for those, and all of these are free. We're happy to share with you that our speakers today have created some patient infographics associated with their presentations. These are all written at or below a 6th grade reading level, and they can be found on our Symposium LibGuide under infographics. We're also going to put a link in the chat or the Q&A, and we will, when we send you the follow-up material after the symposium, we'll include links to these. Thank you. Sorry. If you have any questions, or you want to ask me something, or you want to email me about something, this is my email address, and just feel free to email me with any questions or comments. Thanks.
Thank you, Erin.